Would you like to see all this? Bismillahirrahmanirrahim. May I have attention, please?
सर वैसे ही बोल रहे हैं.
Topic today is basically for hip and thigh injuries. I'm Dr. Muhammad Yousaf. I have been associated with Pakistan hockey team for quite a number of years as a doctor physio, and then have been the manager with national hockey team for Olympics and other games also. And not only with hockey, I've got all this experience to go along with Pakistan team for say martial art games and other games and Asian games and so on. So having this background in my mind, I would not be focusing purely on the medicinal point of view or the surgical point of view or orthopedical point of view of the lecture, because here it's just an interactive talk, and we'll be discussing with each other and we'll be sharing our experiences, and this is one of the unique opportunities Dr. Bakar has provided to all of us to be on board here, and I'm really thankful to Dr. Bakar. I've been in this field for quite a number of years, and after a very, very long gap. Initially, this thing was initiated by Dr. Nishat Malik. Allah sponsor this name, this is so remote. And the Sports Medicine Association of Pakistan started with this such type of seminar back in 1992. And then there was quite a big long gap, and then Dr. Bakar has been quite influential and has been helpful to collect and gather all the dignitaries from foreign, from abroad, and this one is very unique to share our own experiences with each other. So, having said that, the focus of today's talk, and you have been discussing with the fitness evaluation and say cardiorespiratory responses, other physiological things, and certain medicinal things also. And I heard that our nepalese brother has spoken very well about orthopedics also. So and similarly about the say Dr. Sohail's lecture. So I'm not focusing more on the details of the anatomical and the other things and the other aspects of the hip and thigh injuries. Just skipping on them. So it's basically hip and pelvis injuries are critical performance in the sports. Injuries to the region are account for 5% of the total injuries. And knowledge of the anatomy is critical for that. And you can just have a look on the slides. And the musculature involved is for the flexor muscles. The name of the muscle is psoas, iliacus, pectineus. Similarly for the extension of hip joint, there are certain muscles. Is just an anatomical detail. And for the abduction and adduction, there are certain various muscles also. Myositis ossification is an ectopic bone formation within the muscle. This causes the single severe trauma or a repetitive blows to the same area. Treatment too aggressive initially, should be too aggressive initially, and then including massage. Avoid heat modalities. May require surgery, but high incidence of recurrence if surgery done too early stage. Then we will be shifting our focus towards the. I'll be just covering the dislocations, bursitis, then snapping of the hip, and not to the surgical details of it. So as far as the dislocation of hip is concerned, then it means there's a acquired dislocation of hip joint during an automobile accident, but it's more predominantly in the football injuries once the hip is being flexed flexed, adducted, and internally rotated. Once somebody is going to hit ball, then this movement of the hip is there. And if you see in this slide, there is posterior dislocation which is causing the back pressure towards the base of the sternum, and then the fracture of the lips of the stabilizers. Posterior dislocation is the most common. Usually occurs in the road accident, but if you see in the football and the kicking injuries, where the leg is short, and normally after having this injury, the leg becomes shortened, then it's adducted and internally rotated, and at the same time they are slightly flexed also. Anterior dislocation is very rare, is fairly rare, and has a leg lies externally rotated, abducted, and slightly flexed. Central dislocation, hip dislocation, posterior dislocation occurs with an impact to an adducted flexed hip, often involves an acetabular lip fracture. 90% of the sports, in the 90% of the sports injuries are at the posterior dislocation, and the splint and rapid transport is the treatment. So one hasn't to do anything on the field as far as this is concerned. Anterior dislocation occurs with a blow to the extended and externally rotated limb. The hip is flexed, externally rotated, and abducted. Adduction once going in, and abduction is going out. And external rotation, it means once the limb is being externally rotated. So you can have a sciatic nerve, like say sciatica is fairly commonly known, and is damaged with the posterior dislocation because the root of the sciatic nerve which is being passing from the foramen. Then we are coming towards the hip bursitis. Just I want to have to share with you guys that certainly once you are interacting with the sports of the different sports people, they have got very saying that they have got a hip pain, diffuse hip pain, and certainly somebody can point you out. But if somebody is saying that he has got a diffuse pain, then please have a focus in his mind that it may be a referred pain either from the lumbar vertebra or from the sacroiliac joint. And it's not mandatory that it's something doing with that muscle and having a massage on it or giving heat to that. First of all, one has to find it out the reason the reason why this pain is there. It's normal saying that if the pain is diffuse, then this pain is normally because that either that pain is coming from the back, means lumbar 4, 5 or sacral 1, that is radiating from there, or from sacroiliac joint. Then there is a diffuse pain in the buttock. And if the pain in the buttock and along with the groin is there, then it has got the most probably is from sacroiliac joint also and obturator nerve also. And if the pain is being increasing on the running, then it's most commonly it's because of the bursitis, right? And most common bursitis is of the trochanteric bursitis. And similarly, some other bursitis which I show you here, that the pain is normally gradual in onset and can involve the psoas. Is fairly medicine terminology, is fairly medical terminology, but have to go along with it because it's a pure relaxer on the injuries. So if you see the location from there is at the trochanteric bursa, and similarly is the ischiogluteal bursa, and some other bursitis are also there. And these bursas are they are characterized by the deep burning pain located just posterior to the greater trochanter and can radiate down to the lateral of the thigh. Ischial bursitis most commonly occurs after direct trauma, either by the having because of the jumps or by going down. So must rule out, in this case, we must rule out the hamstring injuries, epiphysitis, skeletally immature patient, and osteomyelitis. Care is conservative. Aggressive stretching of the hip region, aggressive stretching of the hip region. Make sure the strengthening to keep proper ratios in the mind. It's very important. Strengthening exercises should not begin up with immediately. We will have to keep the ratio in the mind that how much is there, and periodic evaluation and periodic testing of the muscle should be carried on so that the strengthening exercises should be performed accordingly. Posterior pubis. Then is anybody going along with me, or is just we are aloof? Huh? Yes. Question we'll deal at the end. We'll deal at the end. So, see, can you get up and say about something about posterior pubis? Posterior right pubis. Please get up.
I think
he is Major Tosif. He is working with me. He is very good in sports and exercise medicine. Has done diploma, and they are upcoming people. And I think we should share his assessment.
Why did you ask such difficult questions?
He's that intelligent. That's why I'm asking.
I think this posturitis.
ये सब पहले से planned है.
I think this posturitis pubis is more related to the lecture Dr. Suhail has delivered yesterday. That is like pubalgia. It is the different terminology, but it comes from mind. Although I don't have a specific knowledge on that one, but what it comes in my mind that is related to the lecture of pubalgia of Dr. Suhail.
And that has been very well covered already. Thank you very much. Osteitis pubis is of lesser trochanter, radius vas muscle, greater trochanter, ischioplasty, inferior pubic line. Epiphyseal injuries of the pelvis. You have to further be ready. You will have to get up after some time. Right? Is slipped capital femoral epiphysis. Is Fatma, can you get up, please?
This is a condition which is more prevalent in a younger age group actually. So since we are dealing with athletes of all ages, so we consider these certain injuries, we can say, but they're not very common in older athletes. They're not the people who are practically into athletic fields. So these are the ones that the institutions and organizations where the younger age group people are being trained. This is one of that condition. And similarly, Percy's disease is also covered in the same topic. It's a non-inflammatory disease basically. And
why it is so common in younger?
So because of the vasculatures and because
जरा उन्होंने दस्या हो तो कुछ नहीं It's good.
Yes.
Good to know that.
It will come to you, inshallah. I'll tell you very soon.
I'm happy to pass it on.
So when we go to the posterior slightly, so these joints and structures being supplied because in the initial stages, the vascularity of the individual once they undergoing strenuous sports and activities, that is the time in such condition because it's not an inflammatory disease condition. So the next one, I'm talking about Percy's disease. So next step.
Next page.
This one, sir, I'm talking about Percy's. This is avascular injury, I'm talking about Percy's. So actually, it is once the muscular injury or some certain movements are made by the individual player in which there is an injury that can result in interruption of the vascular supply of that individual tissue, and that results in presentation of the that joint has to be then given rest accordingly treated. Basically, it's not an inflammatory condition or a disease as such. It's a traumatic condition, sir. It's an injury basically which occurs because once the joint is in its position and there is a the vascular supply of the acetabulum and the when it is interrupted or disrupted.
What is the blood supply of acetabulum?
Well done, Fatma. Thank you. Thank you. It's quadriceps contusions then after going through that with those disorders, normally the contusions are there. That some blunt injuries while playing hockey and while playing football. Then the patient has an impact injury with the resultant of the edema, rhythma, and tendinosis. Three steps therapy: acutely place inflection with the ice for 20 minutes per hour for first 24 hours, and once the pain is free, restore the motions. Once from start, strengthening. Before strengthening, the motions have to be restored, and before restoring the motions, you'll have to apply ice for 20 minutes per hour and first 24 hours. Even if there is an emergency, then the player has to play tomorrow. Like we have got an example, we're playing in Aslan Shah hockey tournament in Malaysia. Sohail Abbas is one of our leading player, one of the best player in the world that does a drag flicker. And in the very initial part of the game, he got the adductor muscle injury and started very severe pain, and then he came out from the ground. And then I got about, say, for 40 minutes, applied ice on him, then strapped his adductor muscles and made him ready to play for, say, 4 to 5 minutes maximum at this time. And then I came to coach, I went to coach and told him that he's ready for 4 to 5 minutes only. Then I was walking along with him along the line in the next half for the last 5 to 7 minutes. And as the ball transferred from our half towards the Malaysian half, and that was the time once we were playing for the certain death time. So I just walked him in the ground, and at the same time the whistle was blown for the penalty corner, and the guy was there. He scored the goal, and Pakistan won the final. So this how the doctor, and this how a physiotherapist, and this how somebody can help the team at very right time, probably if he knows the team. And that's where the icing has played a very important role, and then strapping on it and isolating that adductor muscle so that maximum pressure could not go on him, and he was able to just crack that flip. Then he was on the ground and evacuated on the stretcher from that place. Is hamstring strains? They are fairly common. They are fairly common. The biceps is the most common injuries. Is because of the poor flexibility and improper warm-up, and contributes towards the injury. Seems to have associated with 60% hamstring, and as far as the ratio of the quadriceps is concerned, injury often occurs during sudden acceleration or overextending during deceleration. Initial case is the initial care is price. Once pain is free, then stretching, isometric stretching can begin. And can begin the sport-specific rehab once the pain is absolutely free and able to run at least 90%. Stress fractures. So, see, can you divulge on stress fractures? Sure. Please.
Stress fracture commonly it occurs because of the micro traumas repeatedly acting on the same point. Although in the sports, stress fractures are not very much related in the sports world, but although being working in army, we used to have lots of new recruits and people coming
in sports. If you are overdoing or it's fairly common.
And I wonder how come that the soldiers doesn't have this stress fracture, although they have a big shoes and tapping on the ground.
They very common. Commoner than even sports world.
They are more common as compared to the sports world. All armies are definitely not. All armies are definitely not, because the other armies in the world, and particularly the Western armies, they have got a inbuilt culture, inherent culture of gym and training themselves right from the very beginning. So once our soldiers, once our officers, they are coming to the PMA and coming to the centers, they come from an atmosphere of this bloody, the game which is going on today is of internet business, and have got long hairs and very, very weak muscles. There's no sports anymore in Pakistan. So basically having a weak background, and then they come up there, and obviously they are prone to such sort of things. And that's what the difference is. And from where actually we have started a new training regime in Pakistan Army, No, we are progressively developing their after having a proper conditioning program. We have got very expert conditioning experts with us, like Col Muhammad Yousaf. He has done degree from Hungary in this regard, and we have got certain scientific background knowledge of this thing. And now we are developing our own physical training program accordingly to that. And in future, inshallah, you will never see the stress fracture business anymore.
What was the data like? You see, the stress fracture is more in PMA, or
yeah, it's more in PMA as compared to the centers, because the center guys, they are normally coming from the village background. They have to be
that's the difference.
Yeah, that's absolutely.
And the problem is with stress fracture is that cannot be diagnosed on a simple X-ray.
Yeah.
You have to go for a bone scan, and the bone scan, that means that once we have already provisionally diagnosed it, that other conditions have already been ruled out.
Yeah.
So it's a tricky situation in which we may be thinking upon other issues.
Actually, from
the stress
here.
fracture, see if it's 2 or 3 weeks old, you can get it on the X-ray.
Yes, after 2 to 3
What are
weeks.
the reasons for the stress fracture, and what are the common signs for the stress fracture, and how to cope with it? How to avoid it?
Is once we'll finish up, then I'll tell you. But most common
side
sign.
because this is the
But
problem. The question comes
okay.
instantly, so that's why I was asking.
But it will be better, I think, that the question answer session is always at the end.
It is always at the beginning, because then this would be the distraction, and then we'll be just focusing on the stress fracture. Right? You better write it, and then we will come across it. This is the some of your answers are coming in the next few slides. Like femoral neck stress fractures are there. The patient often present with a pain in the groin and in inguinal region. The night pains and often mixed with the diagnosis of the trochanteric bursitis. Bone scan is the answer, and compression stable is the treatment for them. So pelvic stress fracture, you can see from here, is inferior ramus is the most common site, and can also occur with the ischial and superior MI also. As far as pelvis is concerned, otherwise there are other sites of stress fracture also, like tibia and some other sites over there. Because there is a single break in the ring, the treatment is symptomatic and can take 2 to 6 months to completely heal. And the femoral shaft fractures are often occur proximal 1/3 of the medially adductor magnus location. Right. We report as vague distal thigh pain. Vague distal thigh pain. 85% of the time they have a positive fulcrum and or object. Special stress fracture, cycle stress fracture occurs in military recruits normally, but in the patient with the repetitive jumping, so they also have got. So SI dysfunctions that does not resolve with the OMT. Volleyball player. Yeah. Weakness of the posterior inguinal wall, which causes the groin pain, does not respond to the rest or conservative care. Players often continue to play with the pain. This is one of the problem also that I faced in the hockey team. In the hockey team, that while we were there, the people used to hide their pains, just because if they are going to tell the pain, and the people who are there to manage and treat the pain, they are not probably helping them out. So, but they go to the coach and say that he is lingering, he is dodging. So because of that thing, or probably because of their insecurity in the mind which they have got, that if you tell about the pain, they will say that okay, you guys are very weak, you are dodging yourself, and they'll be eliminated out of the teams. So they keep on playing with that pain, and ultimately like the shoulder pain, say overt and covert injuries are there. Similarly in the hip they are there. So with these injuries, we keep on playing and keep on ruining their injuries, and ultimately landing into a big trouble.
You had been a manager, and you had been a doctor, and you had been a manager and a doctor also.
Yeah.
What is your experience? The players open up more easily with the doctor or with the manager, or the joint designation is helpful?
In Pakistan, typical scenario of insecurity of the job, insecurity of the life, even insecurity of everything. And particularly the players with whom I was dealing, that was from hockey background. And hockey people, they are normally from a humble background. So they have got maximum security.